Well, good afternoon. We appreciate you joining us this afternoon. I'm Sandy Stimson, Mayor of Mobile, and I'm joined by Commissioner Messiria Ludgood and by Dr. Asho, head of the Mobile County Health Department. It's been 3 weeks since we talked to you last. A whole lot of things have happened in those 3 weeks, and a lot of them are good things. As we sit before you this afternoon, we can tell you that we no longer lead the state in the number of cases, which is a position that we're glad to relinquish. And it didn't just happen that somebody started outdistancing us. I really believe that because of things that we have done as a community have put us in a position so that our numbers seem to be in check, maybe a little better than some others. So if you look at things that really we should be paying attention to now is what kind of shape are our hospitals in case we start having increased cases. Well, actually, our hospitals are in excellent shape. Not only do they have the beds available, but they also have procedures and protocols in place to making sure they're only admitting those patients that truly need to be admitted with the COVID virus. Another thing is that our death rate is down. We're very fortunate to see the number of deaths on a weekly basis declining in the city of Mobile. Also, if you look at a 7-day trend and a 14-day trend, the cases are down. As we think about going forward, in my mind, the way I look at it, the more people that have the virus, the more apt everybody is to get the virus. It's just going to spread if we do not do the things that we know that we should be doing. So while we have some good results now, I will say this going forward also, that we're in great shape when it comes to testing capacity. I would say that we're in good shape when it comes to the tools the hospitals need. But what we don't have right now is we don't have everybody's attention quite to where it should be, recognizing that with the stay at home, the safer at home order, and with everything starting to open back up, I think a lot of us have dropped our guard. In just a moment, I'm going to flip to Dr. Asho, who will talk to you about personal responsibility. But this morning I had an opportunity to eat breakfast at one of our local downtown restaurants. The owner sat down at the table with me and he said, "Mayor, when do you think that we'll be able to really open up?" And my comment was, I did not know. And that's just the truth, because when you look across the state of Alabama and you see the numbers going up at the rate they're going up, there is no way that the governor really has any confidence to release anything that hasn't already been released. And so that restaurant owner is one of tens of thousands around the state of Alabama that really do want to open up. But we're not going to be able to do that unless we do a few things differently than what we've been doing. So with that, I'll flip it to Dr. Asho.
Yes, thank you, everyone. Mobile County Health Department thanks the community for the hard work, and obviously what we have implemented seems to be effective. At this point in time, we need to be very, very cautious about personal responsibility. And personal responsibility is, 1, wearing a face covering, 2 is the 6-foot social distancing, 3 is wash your hands frequently, and 4 is clean the surfaces which you may have your hands on. One of the interesting things that I personally do is I use my own writing utensil when I sign for something, when I go to an establishment and go in and out and have to sign. I use that, and I think really, really what's important is we need to respect the health of other people. What we do as individuals, we could say, is our individual rights and our freedoms, but when that impinges upon other people's health and well-being, that's something we should really think seriously about. Personally, wearing a mask, I wear a mask for everybody I'm around in contact with, along with hopefully help protect myself. So I encourage everybody to please take this seriously. We've had a report of a 20-year-old in Chicago who has had a double lung transplant with no other underlying serious medical conditions, 20 years of age and a double lung transplant. So this COVID-19 can do serious damage to young people, and everyone needs to take it as a disease that we want to prevent. I hope nobody else has to go to the hospital in Mobile, Alabama for COVID-19, that everybody does the right things to prevent the spread. Ms. Syria.
You know, somewhere down the line, I don't know where it started, but there are certain times in the community it appears that we think that COVID-19 is over, that it's done what it's going to do and that it's moved on. That couldn't be farther from the truth. It is not a hoax. I don't care how many times you see it on Facebook, hear it on whatever news channel you're listening to. It is not a hoax. It's real, and people are dying from it. So when you get these opportunities, when you're invited to these large gatherings, whatever they may be, whether sometimes it's a homegoing service, a funeral, sometimes it's a party, just getting together because people are tired of being apart, somebody's got to be the one who says, no, let's not do this. We need somebody in every community and every family to be the one to stand up and say, no, we aren't there yet. Let's not. Rather than just going along to get along. And then, you know, I walk every day in the mall, and when I'm walking through the mall, I get all of these side eyes from people who see me in my mask without theirs, wondering, I guess, why I have a mask. We still need to cover our faces. And I'll just tell you, for me personally, I'm not going to patronize anywhere that doesn't care enough about my health and the health of the people coming in to cover their faces. And so if you go in somewhere and they aren't practicing social distancing, they aren't covering their faces, everybody's in there acting as if it's business as usual, you might want to rethink whether that is a safe place for you to be right now. Bottom line is, we need people all over the community who say, I'm going to be the one person in whether it's my place of worship, whether it's my social circle, whether it's my family, I'm going to be the one who says the time will come when we can come together in our large groups, but that time has not yet arrived. And if we do that, then we can continue to maintain what we're seeing in our community. We can continue to see the decline that we're seeing. Otherwise, we are going to be the next big story. And none of us want to do that. We've been that. We've led the state in cases. We've led the state in deaths, and we don't want to go back there. And we don't have to if people will just accept the responsibility. Each of us individually just accepts the responsibility to take care of ourselves and those around us and those we love.
Okay, so we'll be glad to open the floor up for questions.
Questions from Arthur Mack with the Centennial Call News.
Yes, this question is for Commissioner Ludgood. Recently, the County Commission approved the moving of numerous polling sites to larger locations for the July 14th runoff elections due to issue with COVID-19. Now, depending on the situation regarding the coronavirus, are there any plans in the works to move other polling places to larger locations for the November general elections?
Right now, we're just dealing with the July 4th, 2020. Hopefully, we'll be able to use the same ones in November, but we aren't sure about that. Different intervening circumstances happen, but we will be planning November's election with COVID-19 in mind, just as we've planned the July 14th elections.
WKRG.
Yes, hello, this is Kimber with WKRG. Can everyone hear me? Sounds good. We have a couple questions. The first one, this is for both Mayor Sandy Stinson and Dr. Eichhold. With several weeks of nationwide protests, including here in Mobile, what impact do you believe the mass public gatherings have had on the spread of COVID-19?
The question about mass gatherings and people exercising a right to protest, and the impact it's had on COVID-19. We have not been through the incubation period, so it takes about 5 to 10 days, 12 days for the incubation period to occur. We saw a lot of people were not exercising personal responsibility while out and about, so we really don't know at this point in time. But if people are going to go out, whether you're going out retailing or going out to exercise your civil liberties, please use the proper face covering and please distance. It's out of respect to others and out of the protection of your own personal health. But we will have to wait and see with what the numbers over the next week to 10 days.
So we got part of Dr. Eichhold's answer, but with several weeks of nationwide protests, including here in Mobile, what impact do you believe mass public gatherings have had on the spread of COVID-19?
From the Mobile County Health Department data, we have not seen an increase in cases due to the protesting. Some of the protesting has not been through the incubation period, so we just have to watch the data and see. If people are going to go outside, regardless of whether you're going out for retailing or going out to express exercise your civil liberties, please cover your face and maintain the 6-foot social distancing.
I'll answer that. Dr. Eichel says, as Dr. Eichel said, there's no data that we can point to that shows that there has been an increase in cases. But if we know that you have increased cases in church choirs, people attending funerals, and any kind of mass gathering, even on a smaller scale, there's, to me, logic that would tell you that you will have an increase in cases due to the social protesting. I don't know that we will ever be able to specifically say that cases were spread from social protesting unless there was tracing going on, because so many others were going to the beach, taking vacation, doing other things at that same period of time. But it just stands to reason that if you're social protesting and you're not spacing yourself and you're not using a mask, everybody around you is vulnerable, and you're vulnerable yourself.
Next question.
Thank you. Another question is, what would you say to those who argue that the protests could fuel a second wave of the virus?
I would comment we haven't gotten through the first wave yet, so it could make the first wave worse. But again, this is a personal responsibility. We have to wait and see. And like the mayor pointed out, we need to exercise caution regardless of where you're going.
On the flip side to the past question, what is your message to those who feel that any COVID-related side effects of the protests are necessary to bring about change?
I would say you don't need to have catch COVID-19 to express your opinion, and that would be something that's not necessary as we go forward. So I would hope everybody be cautious, and the two are not really related. But maybe the mayor or one of the politicians can enlighten me.
I have no comment.
Thank you, WKRG. Next question from John Sharp with AL.com.
Has the city or the health department been in contact with the White House or the Tommy Tuberville campaign about a rally next month, believed to be on July 11th at Lapeer? If so, or even if not, are there concerns about maintaining social distancing at a political rally inside that stadium? And can such a rally even take place under the current state health order?
The city of Mobile has not been contacted by the Trump or the Tuberville campaign, nor have we directly reached out to the White House about the event, because we've not been contacted.
And the current state health order applies through July the 3rd, so this will be after that timeline, and we'll have to wait and see what the governor and the Alabama Department of Public Health recommendation will be at that time.
Next question, AL.com.
Yeah, my next question, Crown Health indicated that its nursing homes are free of COVID-19, and obviously this is good news. Are there any other coronavirus outbreaks at nursing homes right now that you all are monitoring or examining? And are there any other outbreaks occurring at any other close contact facilities that you can talk about?
Yes, there are other cases in other facilities, but we do not have the patient-to-patient spread, and it's a limited number of facilities, and we think the management teams are all responding in a very appropriate manner in order to protect the patients. We're actively testing employees at the medical facilities and working with the facility management, but wherever we have people where we have potential for COVID-19 cases, that has been reported in the Community Corrections Center, but they are working hard isolating, and they have an excellent medical team at Community Corrections. Dr. Bill Schulte was a pulmonary specialist in private practice in Mobile before he became the attending physician for the Mobile County Metro Jail.
Do you have another question, AL.com?
No, thank you.
Thank you. Next questions are from NBC 15.
Hi, I guess a good thing going this late in is a lot of my questions have been answered. Dr. Eichhold, you touched on a little bit with the patient in Chicago with the double lung transplant. The numbers the states are started reporting about the number recovered. Can you talk about recovered, and that doesn't mean recovered like a person recovered from the flu?
Yes, we anticipate, well, first of all, we actually track cases of COVID-19. So the laboratories report patient information to the Alabama Department of Public Health along with phone numbers, and then we follow up the health department with a team and communicate with people who are COVID-19 positive. Obviously, those who are in the hospital, we follow their medical records. So we estimate at this point in time 65 or 70% of the people who've had COVID-19 have recovered. What is the long-term recovery going to look like? We really do not have enough data. Does this COVID-19 cause some type of scarring of the lungs, as we saw in a 20-year-old with no other medical condition? But we feel that the viral load, how much virus you actually have in your body, is going to be part of the formula, and we are not able at this point in time to actually measure how much virus you have. So the long-term consequences, we really have to watch medically on a case-by-case basis, but it does show it does permanent, irreparable damage to the lung tissue, or can.
Your next question?
I wanted to follow up on the long-term care facilities. I know the health department and the Unified Command had worked with facilities to get those outbreaks under control. There's been 2 facilities that reported they're virus-free. Are we turning the corner, turning the tide on those facilities? Have we figured those out?
I think we understand the main form of transmission of COVID-19 in long-term care facilities, and we're working with the management teams to prevent further outbreaks and spread of the disease. There are a very large at-risk population that are contained in these facilities, so the management teams are working with the health department with preventive measures. And I think at this point in time, we feel that we are doing well with the problem we have, but it's not over, and we have to remain very vigilant with the long-term care facilities.
Your last question.
I don't have any more. Thank you.
Thank you. This concludes our Q&A. Principals, do you have any final comments?
I'm good.
Yeah, I would like to tell everybody as we approach the 4th of July holiday, please, you'll be having your family, your loved ones in proximity. There's usually a lot of traveling associated with the 4th of July. So please exercise caution with what we've said, personal responsibility. And one of the things is if you're putting food out, you notice around the community, we don't have any buffet lines. So if you're planning your personal family reunion, maintain the 6-foot social distancing and do not use serving spoons that everybody's going to grab. Kind of give everybody their own spoon and their own utensils as they're enjoying family time together. And again, thank you everyone for taking this seriously.